If you have recently experienced the death of a loved one, you may find this video difficult to watch. Please use your discretion in choosing to view the video. In this video, we will discuss how to appropriately care for and communicate with the family of a deceased patient, as well as how to care for yourself and coworkers when you experience the death of a patient. Critical care staff can confront death frequently. In our clinical specialties, we see death that is traumatic, sudden, and unexpected in all ages, from youth to the elderly. Unfortunately, emergency and critical care settings are in stark contrast to the needs of the dying and bereaved. They are fast-paced, focused on life-saving, lack privacy, can be very loud, and tend to have a poor physical layout. The dying and bereaved need time, privacy, and to be a priority. As healthcare providers in these areas, you may have to deliver news of the patient's death to the family. Let's watch a scenario of delivering this news poorly. Afterwards, discuss how this situation could have been handled better.
Dr. Schoenfeld, 305. Dr. Schoenfeld, 305.
Hey, sis.
Hey.
What's going on with Dad? Any news, or?
Okay, I went to see him on my way home, and we were having coffee, and we were talking, and then he just gets this strange look on his face, like he was confused.
Okay.
And just fell down in the kitchen.
I was worried something like this was going to happen to him. You know, he's so stubborn about taking his blood pressure meds and...
Okay, I rode with him in the ambulance, but I haven't seen him since they took him into the ER about 30 minutes ago.
Okay, has anybody given you an update, or?
No, I keep going to that desk over there, and all they tell me is that I have to wait for the doctor if I want any more information.
Are you Mr. Haven's daughter?
Yes, I'm Sarah, and this is my brother Jimmy.
Dr. Kurtz.
Can somebody please tell us what's going on with our dad? She's been asking for half an hour.
I'm sorry, we've been very busy, as you can see, but I'm afraid I have some bad news. Your father didn't make it.
Didn't make it? I thought we got here in time for you to help him.
He had what we call a cardiac arrest, and his heart stopped.
That's not possible. He's 68 years old. This doesn't make any sense.
I'm sorry. We tried everything we could to get his heart started again, but we just couldn't. Sometimes these things happen.
But he was fine earlier today.
I understand how you feel. I'm going to get a social worker in here, one of ours, to explain some of the details. I have to get back to some of the patients that are waiting on me in the back. Stay strong.
Wait a second. I want to see my dad. I'm